In pelvic girdle, we have anterior and posterior muscles. Anterior muscles we can see here, they are psoas major and musculus iliacus, these two muscles. Sometimes maybe psoas minor, but it is small muscle and here it's absent. And psoas major and musculus iliacus combine together and leaves abdominal cavity below of inguinal ligament and attach in the region of lesser trochanter. This is. And together they forms iliopsoas muscle, musculus iliopsoas. It's participating flexion in hip joint, supination, and it moves trunk forward. Another muscle, this musculus tensor fasciae lata. This muscle starts from iliac crest and anterior superior iliac spine, and tendon of this muscle attached to the fascia of the thigh, that is fasciae lata, and makes tractus iliotibialis. This tract is attached in the region of lateral condyle of tibia and participates in flexion in hip joint and flexion in knee joint. Posterior muscles I show you in posters, and now muscles of the thigh. On the thigh we have three groups of muscles: anterior, medial muscles, and posterior muscles. Anterior group, musculus sartorius. This muscle starts from anterior superior iliac spine and attach in the region of medial condyle of tibia and tuberositas tibia. Function: flexion in hip joint, flexion in knee joint, supination in hip joint, and pronation in knee joint. All another anterior muscles combine together and forms quadriceps, musculus quadriceps femoris. And quadriceps consist of four muscles: musculus rectus femoris, musculus vastus medialis, musculus vastus lateralis, and musculus vastus intermedius. Together, three vastus muscles and rectus muscle makes quadriceps, and quadriceps attached to tuberositas tibia. Main function of this muscle, that is extension in knee joint, and musculus rectus femoris, the same, participate in flexion in hip joint. Now, medial muscles of the thigh. Medial muscles, they are pectineus muscle, musculus pectineus, musculus adductor longus, musculus adductor brevis, musculus adductor magnus, and musculus gracilis. All medial muscles participate in adduction in hip joint, and most of them participate in flexion except musculus adductor magnus. Adductor magnus participate in extension in hip joint. And now posterior muscles. Posterior muscles they are biceps of the thigh, musculus biceps femoris. This muscle consists of long head and short head. These two heads join together and attach in the region of head of the fibula. Biceps participate in extension in hip joint and flexion in knee joint. Another two muscles are musculus semitendinosus and musculus semimembranosus. All of them attach in the region of medial condyle of tibia. Both of them participate in extension in hip joint, flexion in knee joint, and medial rotation in knee joint. Last muscle of the thigh, that is popliteal muscle, it is on the floor of popliteal fossa, but here impossible to see because it is in deep part of popliteal fossa and we cannot see this muscle. That is all muscles of the thigh. Some words about topography. First of all, under the inguinal ligament, we have space, and below of this space, iliopsoas muscle comes to the thigh. Femoral nerve, and here it is femoral artery and femoral vein. And space under the inguinal ligament subdivides into two halves. Lateral part, that is lacuna musculorum, where we have iliopsoas muscle and femoral nerve. And medial part below of inguinal ligament, that is lacuna vasorum, because vessels here it is, artery and vein, lacuna vasorum. And medial angle of lacuna vasorum, that is femoral ring. Femoral ring consists of four walls, anterior and superior wall, that is inguinal ligament. Medial wall, that is lacunar ligament. Posterior wall, pectineal ligament. And lateral wall, that is femoral vein. And sometime, through this femoral ring, maybe passes femoral hernia. If you remember, we already said about inguinal hernia through superficial inguinal ring. Do you remember? And in male, more frequently inguinal hernia. But in female, femoral ring wider, that is why in female, frequently femoral hernia. In this case, femoral ring that is inlet into femoral canal. And hernia in this case passes between two layers of fascia. My finger, that is, I show you superficial layer of fascia lata, it has superior horn. And behind of vessels, we have deep layer of fascia lata. And hernia passes between superficial and deep layers of fascia lata and leaves canal through opening in superficial layer, that is hiatus saphenus, that is place where subcutaneous vein, that is vena saphena magna, comes into femoral vein, that is inlet of femoral canal, that is annulus femoralis, and outlet of femoral canal, that is hiatus saphenus, and walls of femoral canal, anterior wall, that is superior horn, which is fused with inguinal ligament, posterior wall, deep layer of fascia lata, and lateral wall, femoral vein. In normal, femoral canal is absent. Only in time of femoral hernia we have femoral canal. What else? In normal, we have canalis adductorius. This canal, look here. Now my forceps is in canalis adductorius. This canal has femoral artery and femoral vein in a lower third of the thigh. And it has three walls. Lateral wall, that is musculus vastus medialis. Medial wall, that is musculus adductor magnus. And anterior wall, that is lamina vasto-adductoria, that is fascia of the thigh, fascia lata, which overlap over the vessels between musculus vastus medialis and musculus adductor magnus, that is lamina vasta adductoria on anterior wall. And last, on the thigh we have just a moment, femoral triangle, trigonum femorale. Femoral triangle, lateral side of femoral triangle, that is sartorius muscle, medial side musculus adductor longus, and superior wall, that is inguinal ligament. And floor of femoral triangle has two grooves. This is sulcus iliopectineus, and here it is sulcus femoralis anterior. Here it is, that is all. And now I show you muscles on posterior muscle. Posterior muscles of pelvic girdle, they are musculus gluteus maximus, below of this muscle, musculus gluteus medius, and below from this muscle, musculus gluteus minimus. 3 gluteus muscles, maximus, medius, and minimus. Maximus muscle start from iliac bone and sacral bone and attach to tuberositas glutea. Medius and minimus gluteus muscles start from iliac bone and attach to greater trochanter. Extension in hip joint for musculus gluteus maximus, gluteus medius, and minimus. They participate in abduction in hip joint. Anterior fibers participate in pronation or medial rotation, and lateral side or posterior side of this muscle moves thigh laterally, that is lateral rotation or supination of the thigh. And other muscles. Musculus piriformis, piriform muscle. It starts from anterior surface of sacral bone, passes through greater sciatic foramen and separates this foramen into two, foramen suprapiriforme and foramen infrapiriforme. Through these openings, a lot of vessels and nerves passes. That is why in next semester you will repeat suprapiriform and infrapiriform foramen when you will study vessels and then nerves. And this muscle also attached to greater trochanter. Next, musculus gemellus, superior and inferior. They are twins muscles. They start from sciatic bone, and superior gemellus muscle start from spina sciatica, and inferior gemellus muscle start from tuberous sciaticum, and both of them attach in the region of fossa trochanterica. Function supination in hip joint. Between them we have internal obturator muscle, musculus obturatorius internus. It starts from walls of obturator opening of the hip bone and attach the same in the region of fossa trochanterica. Function supination in hip joint. Musculus quadratus femoris start from tuberous sciaticum, attached to the crista intertrochanterica. Function supination in hip joint. Here impossible to see musculus obturatorius externus. The same like musculus obturatorius internus, it starts from obturator foramen and attach in the region of fossa trochanterica, and the same function supination in hip joint. This is sartorius muscle. Here is musculus tensor fasciae lata. This is musculus rectus femoris, that is part of quadriceps. And here, that is medial muscles of the thigh. For example, this is musculus adductor longus. And here we can see femoral triangle, trigonum femorale, between inguinal ligament, sartorius muscle, and musculus adductor longus. Any questions? Well, that is all.